Back pain patients are the commonest patients that drop into a OPD in an orthopedics department or in a neurosurgical department. The reason being that we are all two-legged animals and our back is a load-bearing structure, unlike the animals four-legged, where the back is a horizontal structure and it's not taking the load in the same manner as it does in our cases. So the commonest places where we tend to get trouble because of this is the lower back, because we are sitting all the time, standing all the time, bending all the time, and there is no activity that we do from the time of about 6 a.m. in the morning till about midnight when we go off to sleep. That doesn't abuse our backs. Neck is another area which has become a problem region because of the fact that nowadays computers and mobile phones are very commonly available for us. And there is no activity of life again which do not require these utensils to be used. So the patients are usually coming in with either muscle spasms in their back or muscle spasms in their neck. As these spasms keep coming again and again and again, the structures in the back also start to fail. And the commonest organ or the commonest material that fails in the spine is the disc. It is supposed to hold the two vertebrae together, provide it a cushion so that there is a shock absorbing ability that the spine should have, and slowly that fails. When it fails, the disc tends to come out, and it comes out into the area where the nerves are coming from the brain in the spinal cord and coming down all the way to the tailbone, from where it goes down to the legs, etc. The pinch of these nerves is what is called as a back pain sciatica or a brachyalgia so far as the upper limbs are concerned. Patients come to doctors for these. Now the treatment for a slip disc varies depending upon what kind of slip that has happened to the patient, how much pressure is available, is being put onto the nerves, and to what extent is the nerve in jeopardy because of this pinch. Most of the time the pinch is just an irritation, so it's a pain that the patient comes in with, who responds very well to rest, medications and physiotherapy. So 99% of the back pains are actually non-sinister back pains, and they get better with rest of about 72 hours, medications and physiotherapy if at all needed. There are others whereby you need to do something for them. These are the discs which are pinching onto the nerve, causing them to become weak, causing them to become painful, and are not getting better at all. The methods of deciding what treatment one should get is by clinical examination of the patient to see if there has been a neurological deficit. By deficit, we mean weakness in the muscles that are being supplied by the nerve. If there is no deficit and pain is the main issue with which the patient is troubled, then you can offer him injections like epidural steroid injections, foraminal injections, which are basically injections given to the specific nerve root. You can give procedures like ozone discolysis, whereby you pass in a gas called ozone inside the disc that reduces the inflammation in the disc around the nerves and also reduces the volume of the disc. Then you have procedures like laser, IDET, which is basically vaporizing some amount of disc material inside the disc. You have other procedures also like percutaneous disc decompression. All these procedures are basically pain relieving procedures responsible for reducing the inflammation around the nerve. Then we have specific procedures. These are the ones that require intervention, whereby we can do a microdiscectomy, an endoscopic discectomy. Both are basically removing the extruded disc which has come out and which is pinching onto the nerve. We have fusion procedures for those patients who are very heavy, have developed an instability, and because of this instability are not managing well. Hereby, if removing a simple disc will not be an answer for them, you may need to fuse those joints which are also causing the pain. Then we have another category of patients who are older patients, somewhere around 50s and beyond. These patients, besides having a slip disc, have also developed compensatory changes in their spine. This involves the facet joints, which are basically joints of the spine which have become swollen or become bigger or become modified, and they are causing more pain. Such patients would require surgical stabilization, may require an artificial disc, or may require what we call these days as dynamic fusion or dynamic stabilization. So these are various kinds of procedures, all to be discussed, to be looked into by the doctors, and then an appropriate procedure being offered to the patient. What is most important to understand in all this is that there is a cure available for a back pain, and most of the time this cure is non-surgical. Thank you.